kids often do have falls, they bump into each other, and they often have what we call sort of minor traumas, right? And they often seem quite all right after that, and they are actually quite okay. But sometime, you'll have a nagging feeling, yeah, I'm thinking it is minor, but is it really minor? Can there be something serious? Do I really need to do something about it? Is it really a minor trauma? So how do you know? How do you know after a sort of relatively mild traumatic incident what you need to do? Let's try to figure that out. I am Dr. Agnisekhar Saha. I am a pediatrician, consultant pediatrician and pediatric intensivist. We can, trauma, especially minor trauma, are pretty common, especially in toddlers and younger kids. But the thing is, when you say minor, sometimes even apparently minor traumas can have significant effects. So, what are the red flag signs that, if happens, can indicate that something serious is going on? Let's first talk about head injury, because it's very common, they'll fall or something, they often bump their head into something. So if there is a history of head injury, then what are the things that you should look for? The first two things I will say is common sense. If the kid is having some convulsion, if the kid is unconscious, then of course something serious. But if the kid vomits, and maybe not just one of vomit, but especially if it is recurrent, repeated vomiting, then that might be serious. If your kid is either too drowsy, too flat, or too hyperactive, both can be significant. In older kids, if they complain of a persistent bad headache after a head trauma, then that is also significant. So persistent vomiting, excessive somnolence, excessive sleepiness, or excessive irritability, complaints of headache, these are the most important signs. If you are seeing any of those, along with of course unconsciousness or convulsion, then it can be something serious. What about limb injury? So if there is any injury in the limb, then look whether, if he is not using that limb at all, he is not moving that limb at all, or he is using it but much less compared to the other one, then that can be significant. If that is associated with significant swelling, then that is even more, and pain, that is even more. Okay, so not using the limb as much as the other one, or not moving it at all, if that happens, along with swelling or pain, or even without an absence of swelling or pain, that can be serious, right? The other thing is, if after some injury which apparently looked trivial, if the kid becomes progressively lethargic, progressively pale, then that might mean that some internal bleeding is going on. Then also you need to be cautious. And if he develops some sort of breathing problem after any trauma, that can also be serious. And the third thing that we often face is bleeding, that is, the kid is bleeding from somewhere. If the kid is bleeding from somewhere, what we can do? What we can do is compress. Basically, just keep that area pressed, okay? And what the most common mistake is, you press it for maybe 1 minute or 2 minutes, and 2 minutes seems eternity at that situation, and then we take it off and see whether it is bleeding again. It is that taking off which is the wrong thing. So what you need to do is give a firm pressure and keep it on at least for somewhere about 10 minutes by the clock. And if it will be good if you can also add some cold compress along with that. And the other thing is, people use a lot of bandage. If you use a lot of bandage, then your pressure will not be very effective. So don't use a lot of bandage. If you need, of course you will need, you cannot sort of press directly on a bleeding skin, but don't use a lot of bandage. Use a little bit of bandage so that your pressure is effective. So that's what you need to do for controlling bleeding. And most of the time, if you press it for 10 minutes and then take it off, you will see it has stopped. If it has not stopped even after that, then you need to see a doctor. And the last thing is just use a bit of common sense, because what is the mechanism of injury? How has it happened? That is also very important. As for example, suppose your kid was running around and then he just fell and bumped his head. That is one. And the other thing is your kid was on a swing. He was swinging and then he bumped his head. Of course, the second case can be more serious. He was running and then just fell down, and on the other hand, he was swimming and then he banged his head. When he is swimming, it is much more likely that it may be more serious. Now that we have talked about the serious bits, let's talk what are the reassuring bits, and that is what happens most of the time. After the injury episode, of course, the kid will be upset and the kid will cry, kid will be clingy, that's fine. But they are, by default happy creatures. So they will come out of it. And most of the time, within a very short period of time, they will be their usual happy, active self. Okay? So they will be running around, they will be happy. And if they are back to their normal, usual happy and active self, and they have eaten something and they have drank something and they have tolerated it, they have kept it down, that's very reassuring. If that happens, then you can be reassured that something serious is possibly not happening. I hope this helps. Thank you.